regardless of what your labor support team looks like. ACOG, American College of Gynecology, states that if a woman has a continuous labor support in addition to medical staff, she is more likely to have a faster labor. Her need for pain medication is decreased. She's less likely to have an operative delivery. That's the use of forceps or a vacuum on the baby's head. She's less likely to need a C-section, and there's less reports of dissatisfaction with the woman's labor. And statistics even show greater APGAR scores. An APGAR score is a score we give the baby at 1 minute and 5 minutes after delivery that rates their overall health at that time. Let me show you how to be the best labor support for your woman, because she deserves that. She's done an incredible job carrying this baby. We are going to quickly roll through this information of 8 great major tips on how to best support her. Dare I say you are going to be the Tom Brady, LeBron James, Ronaldo, Ontario? Cristiano Ronaldo of labor and delivery. I'm gonna help you rock this. I'm gonna help you be her rock. Number 1, be patient. The most common question I get from the significant others in the room is, how long is this going to take? Once a woman is in an active labor, now that's defined at 6 centimeters. A woman needs to be 10 centimeters to have a term baby vaginally. So once she's at 6 centimeters, she should be dilating about 1 centimeter per hour. So that is roughly 4 more hours until she can start pushing. But every woman is different and every labor is different. So this stage may take a little bit longer or be a little bit shorter. When the woman is 10 centimeters, she can start pushing. This is called the second stage of labor. And this usually takes about a half an hour. But again, every woman is different and every labor is different. It can take just a couple of minutes up to several hours. Number 2, give your woman the time and attention she is well deserving of. This is the time of her life that she is most vulnerable and she needs your love and attention. Studies even show loving on her and helping her feel more secure and safe can help speed up her labor. What I mean by loving on her, if you guys have time to have some private time alone, maybe kissing her, lots of hugs, kisses on the neck, even breaststrokes helps her hormones increase, helps her to relax more. Whatever the woman is wanting, respect where she's at, as every woman is different.
This is not a true story. There was a woman named Eve and a woman named Eva. They were both pregnant and being chased by a crazy monster. They are both in labor. The next part of the story is just too graphic for me to draw. Eva, while she's running away from this crazy monster, gives birth to her baby. And well, the monster is hungry. You can guess what happens next. Eve, on the other hand, ran away from the monster and found herself a cave where she felt safe and secure. Her labor was able to progress and she was able to deliver a healthy baby. We get our genes from Eve. We must feel safe and secure for our labor to continue to progress.
Dr. Dick Reed is the founder of this theory termed the fear, tension, pain cycle. When we feel fear or stressed, our bodies react by releasing catecholamines, or we go into this fight or flight response, tensing the body. This in turn can slow down labor and increase the pain felt by the woman. Turning these negatives into positives in the cycle will help break it. Education or knowledge can lead a woman to better relax and thus accept the labor process. Dr. Dick Reed states the safest and most effective way to minimize the discomforts of childbirth is to enable a woman. How can you enable your laboring woman? Give the laboring woman your attention. Whisper in your laboring woman's ear birth mantras or positive affirmations that she's doing so well, she is so strong, her body knows exactly what to do, she's doing incredible. Even if your woman is planning on getting an epidural, she is going to have this time period before where she needs to learn how to cope with this pain and she needs your support. Number 3, taking care of yourself and knowing your limits. Especially if your woman is planning on not getting an epidural, you are going to be doing even more massage, even more pressure points, which we're going to get to. And so making sure that you have snacks and you stay well hydrated. All sorts of fluid down there. feces, urine, blood, mucus, and your baby's amniotic fluid. I mean, there's so much mess in the labor mess. So if you get queasy, making sure you stay up by your head. Some people have said that they do better if they watch some labor and deliveries beforehand, so they're prepared onto what to expect with the mess. Number 4, assisting to provide options for pain relief, which I have a special video for you. We are going to review massage, sacral pressure, bilateral hip squeeze, utilizing an actual rebozo or sheet or shawl, the knee press, and how you can help her during the pushing phase. So this is Erin. She's 25 weeks. She's my good friend. She's going to help me today. So we're going to get onto your knees, leaning over the yoga ball, placing your chest on the yoga ball, giving baby lots of room right here. I like to use a tennis ball. I love to have a tennis ball in my labor toolkit to use just as a means of massage. So rolling on the low sacrum right here in circles, that should feel pretty nice. You can also take the tennis ball up and down, also using your hands, but the tennis ball does work as giving your hand a little bit of a relief to just provide light touch. You can also do this on the abdomen, long strokes down the spine, or just a steady hand to let your laboring woman know that you are there. All right, so we did our sacral pressure. There's also the bilateral hip squeeze. So you bring your hands on her low back and bring the hands to the hips. Fingers are pointing up towards her spine, and squeeze those hips together, and she should feel an automatic release in her low back. How does that feel?
Wonderful.
Okay, good. Alright, so we did the sacral pressure, we did the hip squeeze, some back massage. We can also use, this is not technically a rebozo, this is just a scarf that I have. In the hospital we use a sheet, or if the doula brought a rebozo, or if the patient brought a rebozo, we'll definitely use that. But I personally do not have one because I'm always at the hospital and I use a sheet, just a flat sheet. So how to make a rebozo with the sheet or a shawl? You fold the sides in, creating a rail just to give you some support and make it the length of your laboring woman's abdomen. So that looks good. I'm going to bring it through. Now you want to make sure there's no creases that would cause extra tension. Just make it nice and flat. And then from here you can actually tie a knot, just like this, a double knot, and put the double knot right on the low sacrum. So when you do apply that pressure, there's already something else there, kind of like the tennis ball already. How does that feel compared to the tennis ball?
That feels great.
Laboring women can also stand up and go up against the wall and just lean up against the wall and move back and forth to also provide that pressure with this. This can also provide some sort of hip squeeze, just like that. All right, so for the lift and sift, this is what it looks like. You are going to bring your hands to the side of the hips, just like this, and massage back and forth. Now this technique is said to get the baby into a better position. It just does that because it's releasing the muscles, helping the mom to relax those muscles. So just going back and forth, you're not, it's not a milkshake. It's just a gentle massage going back and forth. Good. What does that feel like for you?
Releases a lot of pressure.
Good. All right, we can also bring this on the back side, just like this. And this is called the motorcycle, you'll see why. Going back and forth, providing this gentle massage. And again, this just loosens the muscles to help the mom relax. And I would do these two in between contractions, not during contractions. When your laboring woman is in a seated position, the knee press is an excellent way to relieve that low back pain. The hospital beds can actually come into this seated position. I call the hospital beds transformer beds because they can do a lot of different positions. They can also mimic the hands and knees where the bottom drops and the top raises, what we were in before. So now that we're in a seated position, the labor support can either just use their body weight pressing forward like this. You feel that release in your lower back? Okay, and I want you to say the difference from this compared to using the sheet or a shawl. We're going to put this behind you. Great.
Sorry.
No, you're good. Putting your feet up on their knees. And I'm going to push on her knees as I pull forward with the scarf.
That feels better.
You think this feels better?
Yeah. More pressure release.
Okay, that's so good to know.
Sure.
Awesome. Okay, and so you can do these during the contractions or surges, usually feel the best. And then in between contractions, you can relax, you can move, find that rhythm. So you can even use the rebozo, the scarf, during the pushing period. You can use it for tug-of-war. So the laboring or pushing mama will grab a hold in the center and get your bearings, because laboring women can be strong. She's going to pull back as I pull back as she pushes. How to help her feel more comfortable when pushing. You can put a cold washcloth on her forehead. You can fan her. Many moms are just so hot at this time because they're working so hard. Keep a vomit bucket close because they're usually very nauseous at this time. Remind her of her strength. And you can also put a warm washcloth or compress on her perineum, as this can reduce perineal trauma. It can be really difficult to watch a loved one go through so much pain. Do not feel helpless. Sometimes all the laboring woman needs is to know that you are near and attentive to her. 5, do not take offense and do not take anything personal. At some point, your laboring woman may not want to be touched. 6, be her support and her rock, literally. At some point, she may feel so tired that she cannot keep herself up when she's squatting, or help support her, help hold her. A laboring woman may have an altered mental status. What I mean by that is she may forget the things that she planned to do or wanted to do. So be that mental rock. Here are some of my favorite laboring positions when a woman can still move around or doesn't have an epidural yet or isn't planning on getting one. Just make sure you are a better labor support than the little guy in the left corner. You can help the woman in these positions by providing those pressure points and the massage in the low back, hips, legs, wherever she's tensing up. One of my favorite doulas said, roll those hips and loosen those lips. I loved that because if you can help a woman roll those hips, find that rhythm, that can be really beneficial. And loosen those lips, what she means by that is the just to help the woman totally relax her face and her body. If she has an epidural, help the nurse turn her. This can drastically decrease her chance of needing a C-section, as it can help her to progress in labor. It is recommended that a woman is moved every half hour. That can be a lot for the laboring nurse, so be that advocate to help her move. Here are my favorites. When a woman has an epidural, the lateral position using a peanut ball. A peanut ball is exactly what it sounds like. It's a big, almost like a yoga ball, but in the size of a peanut, and it works perfect to put underneath that knee when you're in the sideline position. You can be on the hands and knees. It may be a little tricky with the epidural, but it can be done with some support. Also using the squat bar, the epidural needs to be a little bit lighter for this one. And make sure you use your nurse to help get in the right position and make sure you're safe. The throne or princess, you sit the bed all the way up and lower the foot of the bed, and it sits you straight up like you are the queen for the day, because you are. Number 7, know what to expect. Take the prenatal courses with your significant other. Know that shivering and shaking is so normal during labor and recovery. A lot of significant others get a little frightened about this. It's just all the adrenaline and hormones racing through her body. Know that making sounds in labor and delivery is very normal. Do not be embarrassed and do not tell your significant other to be quiet. It is very normal. Through the possibility of her needing a cesarean section is a good idea, as our C-section rate is 32%. That's 1 in 3 people. Now, the Healthy People goal of 2020 is to decrease that percentage. You can also check your own hospital's C-section rate by going to leapfroggroup.org. Also, using all of these tools that we've talked about will decrease your chance of needing a C-section. That being said, C-sections are great tools that we have. They do save moms and babies. One person can go back to the OR with the woman, and the surgery usually takes about 45 minutes, but you may be in the room for a full 90 minutes with the setup and the cleanup. The woman will either receive a spinal block, an epidural, or general anesthesia. If the mom is already laboring and has an epidural, then they can just dose her through that more heavily if the epidural has been working well for her. If it is an emergency and she does not have an epidural, she may need to have general anesthesia. If she does receive general anesthesia, sometimes they will not let another person in the OR with her. In the OR, the woman will receive a Foley catheter if she doesn't already have one, SCDs, which are sequential compression devices that go on the legs that just squeeze them to keep the blood flowing in the legs to prevent any type of blood clot. And then she will also receive the surgical prep, which is shaving of some of the pubic hair as well as a scrub. Obviously a more extensive recovery versus the vaginal delivery. So you would have a 3-day hospital stay versus the 2-day hospital stay. One C-section does not mean that you will need subsequent C-sections. There is a possibility that you would be able to have a trial of labor for a vaginal delivery with your next baby. Number 8, be involved in the recovery, postpartum, breastfeeding, all of it. She needs you. Her body has just undergone this major transformation. Hearing that she's beautiful and meaning it and looking into her eyes and saying,
It will make a big difference for her.
knowing that crying in the recovery and postpartum period for a few weeks is very normal. Know the difference between baby blues and postpartum depression, not only for her, but also for you. The Centers for Disease Control of the U.S. states that between 5 and 10% of new dads in the U.S. suffer from postpartum depression. That rate also increases when the woman struggles with postpartum depression, interesting enough. So what is the difference between baby blues and postpartum depression? Baby blues is more like a roller coaster of having moments of sadness, feeling depressed and anxious, maybe angry with your partner or other children, crying for no reason, trouble sleeping, hard time making choices, wondering if you are the right fit for this baby, if you can really do this. Now, this usually goes away within 2 weeks without treatment, and that's the biggest difference, is it goes away within 2 weeks. Postpartum depression does not do that. It's a steady decline and it continues to keep getting worse. If you notice that you or your partner are having signs or symptoms of postpartum depression, seek medical help as soon as possible. Know there are so many ways that you can help support her in breastfeeding. Support her decision. Take a breastfeeding class with her, help out with other care for the infant, such as diaper changes, set up a breastfeeding station for her. Make sure she can be comfortable. She has pillows, blankets if she wants, snacks, water, and keep it staffed. Bring the baby to her in the middle of the night, help out around the house, clean breast supplies if you're using any, like the nipple shields or pumps. Be supportive when she's breastfeeding outside the home and help her feel comfortable. In review, be patient, give her your attention and encouragement, take care of yourself, help provide options for pain relief, do not take offense, be her support and rock, know what to expect, be involved in the postpartum period. Overall, you're amazing, good job. All you need to be is really you, because that's who she really needs. Take screenshots of the next slides. I have a packing list for you, the labor positions, and the birth mantras. There you go. There's the 8 tips. You so got this. I'm excited for you and good luck.